Open heart surgery or a minimally invasive operation using a catheter, this doesn't seem to be the question anymore. In hybrid operating rooms, patients are treated by surgeons and cardiologists simultaneously, as a team, in order to unite the advantages of both specialists. But to be able to do this, the doctors need a space that allows both surgical procedures as well as those of a cardiac catheterization laboratory. In short, a so-called hybrid operating room. In hybrid surgery, these two things are now combined, meaning the patient is being operated on with a small incision to the heart, but the actual surgery is performed using a catheter. That means without using a heart-lung machine, the procedure is relatively easy for the patient. In our case, the surgeon is giving an 87-year-old an artificial heart valve, with the constant support by a cardiologist's imaging. Both cardiological and surgical instruments are inserted all the way to the heart through a blood vessel in the groin. The same is done with the folded heart valve itself. This procedure, which is easier on the patient, makes it possible to treat more people. We should hold back this new strategy, especially for patients who are not suitable or are at a too high of a risk for any conventional treatment. For example, the replacement of a heart valve by means of a heart-lung machine. This treatment is very suitable in these cases, because we have seen that when we have treated patients this way who otherwise would not have been treated, we have been able to reduce their symptoms and prolong their lives. In the very best case, this group of patients feels so much better after the procedure that, despite having had a significantly shorter life expectancy, statistically after having undergone the treatment, they live just as long as any healthy person at a comparable age.